My day-to-day role is literally to come in here and make sure that our clients receive the best possible programs and services, and to make sure that we're doing it at the highest standard, but is actually making sure that we meet our operational goals.
As clinical director, my role consists of overseeing all of our clinical programming, so our detox programming, our residential programming, all of our therapists, our case managers, our intake department, and build the curriculum for our program, and then all of our levels of outpatient.
As director of nursing, I oversee the nursing department. I make sure they're equipped with all the medications and equipment that they need to take care of our patients every day. I do a lot of educating for the nurses. I collaborate with the providers to help with the different protocols and make sure that the nurses get them everything that they need to ensure that the patients get the best care that they can.
My day-to-day role here at Footprints to Recover as a director of operations, pretty much I am in charge of all the techs, that is the techs in our housing department, our transitional living. I do oversee our housekeeping, our maintenance team as well too, and the techs in our downstairs department, our detox residential, and our new mental health unit as well too.
What makes us unique is our staff. I think you're going to find caring, dedicated, compassionate staff from the second you walk in the door, from our receptionist to the housekeepers all the way through our clinical staff. The staff here are second to none.
So when you're in our detox program, we're going to help you rid the body of all the toxins in a safe way and keep you as comfortable as we can. If you have a symptom, we probably have something to treat it.
We also have residential programming, which is a full inpatient programming. It's anywhere between 2 to 4 weeks. Typical length of stay is about 4 weeks, and we have our curriculum that is 4 weeks long for that as well. And then our outpatient programs, we have partial hospitalization programming. With IOP, we have half-day programming, so where clients can actually commute or work, kind of get back and forth 3 days a week, and do evening programming as well.
So pretty much we do transport patients to outside meetings, NA meetings, smart recovery, refuge, AA meetings, and so forth.
Our curriculum is developed with transdiagnostic kind of different modalities and skills that help everything, but we do have true trauma-informed care. So we have EMDR for our clients. We teach resourcing and grounding skills for the clients. We also have inner child work, which is super important too, to kind of get to the root of where this trauma occurred, which most of the time is somewhere in childhood. So really working on all those core components across the spectrum of symptoms really helps clients, not just like with one thing that they may be struggling with, but with everything.
With the nursing department, we collaborate with all the different teams, closely with the providers. The providers are the nurse practitioners, the physician assistant that see our patients and ordering and stuff like that, but they depend on us to give them their assessments. How are they doing every day? Are they being compliant with their medications? Do they have questions? We do a lot of educating. We also do more of a holistic approach where the providers will see them for other medical needs as well. Collaborate with therapists, letting them know if patients are having maybe a hard day with anxiety, triggers, cravings, stuff like that. It's like one big giant team.
We treat any mental health concern from substance use to trauma to in between with a whole mind-body approach. So we do yoga, we have breath work, which the clients really love. We have someone come in from the community and really learn how to use breath to ground themselves and to really get into a deep state of meditation. We have a group facilitator who does inner child work, meditation, and sound bowls. So that really helps patients kind of get into a spot where they can use their own breath work, meditation, wise mind, and kind of truly ground themselves to get through distressing moments without, once they have that skill, they don't even need a clinician to help them anymore. It's something that they're going to have for life that they can take on and use outside of treatment as well.
Each one of the programs are set up with their own suites with double occupancy rooms, 6 to 8 people to a suite. Each suite has its own lounge. We have outdoor spaces for each one of the programs. 46 residential beds, 46 beds in our sober living.
Throughout the day, clients are fed all of their meals while they're inpatient. We have a kitchen and 2 chefs on site that coordinate and make meals. So we also have a gym. Clients can use those multiple times a day, and then art and music therapy too. What got me into this field was really a passion for substance use and mental health healing. So a lot of my family members suffer with mental health concerns and addiction. So I kind of rolled right into that and really have a passion to help people who are stigmatized, really. There's not enough help for populations with mental health concerns and substance use. So really trying to advocate for those people and give them any chance they have at recovery.
One of the biggest things for me is I love to make sure that my nurses are educated because they want to be here and they want to take care of you, and everybody knows somebody that is struggling with this.
I chose to work in this field. I just love what I do, and I want to take it with a grain of salt.
If you find the right people over here at Footprints, we have a phenomenal group of therapists, clinicians. When you walk in the door, you're greeted with a very friendly face downstairs. So everybody here is very dedicated and committed to doing the right thing for the clients that we serve. And everybody should have access to the appropriate programs and services. And I think here that's what you get, and that's what actually gives me the best satisfaction.